Whatever happened to predictability? The milkman, the paperboy, evening TV. You miss your old familiar friends, but waiting just around the bend. Everywhere you look, there's a heart, a hand to hold on to. Everywhere you look, there's a lust of somebody who needs you. When you're lost out there and you're all alone, a light is waiting to carry you home. Everywhere you look.
DZ is a 27-year-old pregnant woman from Iran. She came to the healthcare center today for an 18-week ultrasound. She's not been to the doctor for any prenatal care before this visit, which is common in some Middle Eastern countries. Some Middle Eastern people believe that it is only necessary to seek help when you are sick, and because pregnancy is a natural event, they will sometimes only seek help to determine the sex of the child. The nurse introduces herself to the patient and discusses what the visit will entail. She explains that they will need to perform an ultrasound to determine what the sex of the baby is. The nurse explains how the ultrasound will be performed and what the patient should expect. The nurse also makes sure that the patient understands how important it is to be taking folic acid. Middle Eastern mothers were found to be the least likely to take folic acid during pregnancy, resulting in neural tube defects. The nurse determines that the baby is a girl. While this news should be exciting, the father of the child is visibly upset and walks out of the room. In some Middle Eastern countries, fathers want to have a boy so badly that they will either leave the mother or force her to terminate the pregnancy if the baby turns out to be a girl. In this scenario, it would be appropriate for the nurse to help guide the mother and list resources that can help her emotionally and financially through this time. DZ comes back in at the nurse's request for a 32-week checkup. The patient now has a female support person with her instead of the father. The nurse takes all of her vital signs, including weight and abdominal circumference. The nurse comes back into the room and explains to DZ that she is underweight. She asks about what the patient has been eating. DZ explains to her that she has been trying not to overeat, which is common in Middle Eastern pregnancies. Certain Middle Eastern cultures believe that eating too much during the pregnancy can cause the baby to be too large or difficult to give birth to. In this scenario, it's important for the nurse to explain how critical it is for the mother to receive enough nutrition for both her and the baby. The nurse gives her some examples of foods that are high in nutrition but still culturally appropriate. It's common for Middle Eastern women to become anemic during pregnancy. This could be due to the high population of Muslim women in Middle Eastern countries. Muslims typically do not eat pork, so it's important for the nurse to give the patient alternative foods that are high in iron, such as spinach and other vegetables, nuts, and beans. DZ arrives at the hospital 8 weeks later with her mother, ready to give birth. Middle Eastern women typically receive a lot of information regarding childcare from their mothers, and they may request to have their mothers stay in the room with them during their hospital stay. It's important to respect this practice while still educating the patient on how to properly care for their child and not delegating all of the care to the grandmother. Notice how there are no men present in the room. Middle Eastern mothers typically only want female relatives or friends in the room with them during the birthing process to help maintain modesty. It's critical for the healthcare team to understand this cultural practice and to ask the mother if she would prefer a female doctor or nurse over male ones. DZ gives birth to a healthy and beautiful baby girl. She thanks the healthcare team for helping her through the pregnancy process. The healthcare team recognizes the importance of cultural sensitivity and takes pride in the fact that they were able to work with the patient to help provide culturally aware and patient-centered care.